Q&A conversation with Dr. Bob Murtaugh. My name, again, is Stacy LeBaron, and I am the Interim Executive Director here at the United Spay Alliance, as well as host of our monthly podcast, which is called United We Spay. So before I get going any further, I just want to ask folks if you can put into your question box, can you see me and can you hear me? Just doing a little bit of a tech check here before we get going too far along. Hello, Erin, welcome, thank you. Beth, excellent. John, so great to see you. Tracy, good. Marilyn, everything looks good. Technology is our friend. This is what we love. Thank you, Lisa, Rhonda, Mary. Hey, Cindy, it's nice to see you from Massachusetts joining us. Great, so it looks like our tech is good. If you have any issues with regards to the tech, feel free to put a message there in the chat in the questions box. We do have our technical tabby here from the Community Cats podcast, Kristen Petrie, and she's helping us out with regards to the technical side of things. Also in the background, we do have Brianna Lovell-Myers, and she will be helping with answering any other questions that might be coming our way during the course of this Q&A session. I do want to remind you all that this session is being recorded and it will be posted up probably within a few days up onto the United Spay Alliance website. So I am wearing my United Spay Alliance hat today. So also, just for folks that aren't familiar with United Spay Alliance, it is a national nonprofit organization dedicated to promoting affordable, accessible, and timely spay-neuter services. To that end, we are committed to understanding the challenges faced by the veterinary community and finding meaningful solutions to support veterinarians, their teams, and the broader animal welfare community. And the animal loving community beyond that. That's why we're so excited to dig into today's conversation, explore how the VPA role can positively impact veterinary care and potentially increase access to affordable spay-neuter services. Before we get going though, you all know from the podcast, the Community Cats podcast, I love polls. So we are gonna do a couple of polls here. And it looks like everybody's out there, so getting joined and looking like everything is working. So I'm gonna launch some polls. If you are in full screen, you need to X out of full screen to be able to participate in those polls. And sometimes the phones aren't so happy about the polls, but you might be able to participate. So let's see how this goes. All right, we're gonna select a poll here. We're gonna do this first poll, and I'm gonna launch that. So where are you located? Are you in Eastern United States, Central, Midwest United States, Western United States, Canada, or outside the US or Canada? And for those of you who don't know, I usually run these polls about 30 seconds, but everybody's voting really fast. So this is great. You've had your afternoon coffee or tea. Excellent. All right, I'm gonna close this poll, share the results. So we have 56% of you who are on the East Coast. For those of you who are in hurricane territory, I hope you are all doing okay. Central, Midwest United States, about 20%, Western United States, 22, and 2% Canada, and we have everybody is in North America. All right, I'm gonna do another poll, quick poll. So which of the following best describes you? Are you a veterinarian, other type of veterinary professional, animal welfare professional, general public, or other, and tell us what other is in the questions box there. We got people voting a little, they have to think about this one a little bit more. Oh, wow, we have 12% and other, so we must have missed a big category. Put that in the questions box so that I can see what's going on with the other. Put that in that questions box. All right, I'm gonna close the poll, share the results. So we have 52% of you veterinarians, so I really appreciate you taking the time to join us today. Time is precious for everyone, and I appreciate you joining us today. Other veterinary professionals, 6%, animal welfare professional, 22%, general public, 9%, and then we have other, tell us in the chat, and I am seeing volunteer, Learning, I'm here to learn, and volunteer. So that's, I'd say volunteer is sort of what's in that category there. Okay. And then I am going to do one more quick poll. I'm going to launch this poll. Have you heard of the Veterinary Professional Associate, the VPA role before? Yes or no? All right, I'm going to close this poll, share the results. We have 81% of you say yes and 19% say no. So it sounds like folks are somewhat familiar with the position, and hopefully you'll learn a bit more about that position today. With that being said, I also would like to point out a little bit on the GoToWebinar control panel that you have up on your computer. You do have a questions tab there where you just said, yeah, hi, I can see you and I can hear you. That's where you put those questions in that box there. And then if you scroll down a little bit more, there's a little arrow and handouts. And that, you can click on that. There's 3 handouts that we would like you to download today. If for some reason you cannot get access to those handouts there, I believe Bree is going to put in the chat a link to like a Google folder where you can go and get the handouts that way. So we have 2 documents. We have our United Spay Alliance conference schedule. We have an information page about what United Spay Alliance is about and the programs that we do. And then we also have a curriculum document from Dr. Murtaugh that goes into greater detail about what the VPA position comes with during the training. So I'm just pointing that out. So you may want to go over and download those documents or look for the link in the chat from Bree. All right, so without further ado, we're going to get going with regards to our Q&A, and I'm going to just introduce Dr. Murtaugh, and then we'll have him turn on his camera. There he is, great. So since graduating from the University of Minnesota College of Veterinary Medicine in 1980, Bob completed his residency at Ohio State University in 1984 and achieved board certification in veterinary internal medicine in 1985. He served as a faculty member at Tufts University School of Veterinary Medicine from 1984 to 1998, during which he also held the position of hospital director for both the large and small animal teaching hospitals. From 1998 to 2000, Bob was chief of staff at Dove Lewis Emergency Animal Hospital Group, a nonprofit organization in Portland, Oregon. He then joined VCA Animal Hospitals, where he worked from 2000 to 2015 as a practicing specialist medical director, regional medical director overseeing primary care and specialty practice operations across New England, New York, New Jersey, Mid-Atlantic, and Chicago, New Mexico, and Southern California. In 2015, Bob became a partner and chief medical officer at Pathway Vet Alliance, now known as Thrive Pet Healthcare. During his tenure, he played a crucial role in expanding the organization from 15 to over 350 veterinary locations across 37 states, offering a wide range of services for both small and large animals. Bob recently retired from his active role at Thrive and has taken on a new challenge as the founding dean of Rocky Vista University College of Veterinary Medicine in Billings, Montana, the first veterinary college in the Mountain West. He also currently serves as chair of veterinary medicine at the National Academies of Practice. Dr. Murtaugh, thank you so much for joining us for our session with regards to Q&A. So I appreciate this.
Yeah, pleasure, Stacy. Thanks.
All right, so we had asked our registrants to send in some questions ahead of time here. So first, a general question, just to get started. You know, where did you come up with the idea for the VPA position, and why do you feel that this position is necessary?
Yeah, I'm not going to take credit for the original idea. It actually was floated by members of our profession back around 2010. So it's been an idea that's been under discussion for a while. I think, you know, the workforce study issues that have come out in the past few years kind of brought it back around from a standpoint of an opportunity to help on a lot of levels across many branches of our profession, as well as provide a track for technicians and career advancement as well. So I think there's a coalition for the veterinary professional associate. I happen to be on the board of directors for that, but it's made up of people from shelter medicine as well as large animal practice, small animal practice, academia, and other sources of professional input as well. So it's a broad-based interest area, certainly a passion area of my own, but I'm not alone in this idea either. So
now, is the purpose of creating this position ultimately to help alleviate the stresses and the pressures that the veterinary community is feeling today? And are those stresses and pressures being fully acknowledged by the veterinary community at large?
Well, I think you see conflicting opinions on workforce issues. The most recent report that came out that was sort of independent of the Mars study by Lloyd and the AVMA's position was a study of independent economic leaders funded by the American Association of Veterinary Medical Colleges, which showed that by 2032, we're only going to be, even with the new schools coming on board, including Rocky Vista University, we're still going to only be at 76% of the needed capacity of veterinary providers to meet the needs across our stakeholder groups. So the current paradigm, even in its expanded form, is not working completely.
Right. Yeah, and I mean, many of you know I come from the world of cats, which is lots of overpopulation, and there are incredible challenges to access to spay neuter services for cats all across the country and in wide-ranging places. If you wouldn't mind expanding a little bit more about, how does this position work? I mean, how do you get accredited? What's the timeline look like, and what does the training look like?
Yeah, so it's a multi-step process, and certainly if we take a look at physician assistants on the human medical side, it evolved in the late 60s with returning medics from Vietnam, and the academic and licensing and other things kind of caught up with the practice, if you will. And so I think similarly we have a couple of academic institutions. Lincoln Memorial in Tennessee has a master's in veterinary clinical care for 4-year graduate registered veterinary technicians. CSU is planning to roll a curriculum out that you have a visual on in the chat, as was mentioned earlier, by enrolling a class in 2025. The CVPA is working with a national accrediting agency called the Commission on Accreditation for Allied Health Education Programs. They do accrediting for 35 various allied health professions currently, and we're going to use them as our accrediting agency for this position. National licensing examination, liability aspects, all of those things are being considered, and they need to all kind of come together. But this is a 3 to 5 year progression to get it finally in position. And obviously state legislative aspects such as in Florida and ballot initiatives in Colorado, they all kind of are happening together, but it will all come together, and it's not a willy-nilly thing, and it's not something that's being done to harm the profession. It's actually being done to aid everybody that's on this call and more. So I think if people took time to look at it from a sort of curiosity viewpoint as opposed to a fear viewpoint, they might actually see it as something that could benefit them and benefit their teams.
One of the questions, though, we've gotten is, does this help or does this hinder the elevation of the status of the RVT or the certified veterinary technician? Is it, I mean, we're really trying to increase their level of respect and, their role in this space. And so is it pushing them back down, or how is the distribution working?
Yeah, it's in addition to. I mean, I'm all for the fact that we should have title protection and licensing of technicians in all states. You have to ask yourself as a profession, why 40 to 50 years later do we still have 10 states that don't recognize licensed veterinary technicians? So that's a problem that's been going on for a long time. That doesn't necessarily negate the fact that we should also be looking for ways to increase access to care and provider numbers in our profession. These are not exclusionary paths. They can happen simultaneously. They don't have to happen sequentially.
Yeah. And then as you, and there is a significant difference between the VPA and the LVT. What are the key factors that differentiates those two positions?
Yeah, the key factors are that this would be a licensed position under state regulatory aspects, national examination that certifies people to be providers, so they can diagnose, treat, do minor surgeries, do dentistries. But the intent is for it to be under the supervision of veterinarians, so that there's a team approach. I know there's a lot of concern about, well, what does this do to my liability? Well, these people are going to have their own liability insurance. They're also going to be licensed by the state, and they're going to be regulated by the state. So it's not something that puts you at risk. And if you have liability insurance, you're covered anyway. So don't be fearful there. Again, it's being approached in a thoughtful way. It's going to increase access to care. It's going to make it easier for teams to do throughput, whether it's in a shelter or a specialty practice or an equine practice. So it's going to increase access to care, and it'll get more people home on time at the end of the day, to be honest.
Right. And then, and also looking at the high quality, high volume spay neuter techniques that are out there that we can hopefully utilize all across the board in a way so that, there's efficiencies and increased with efficiencies doesn't mean a lower quality. It means it's a higher quality, because if you're doing something on a very regular basis, you're going to get better at it. I mean, so that's another thing too.
Yeah, the throughput, and this will be helpful to those of you that are doing high volume spay neuter, is that these graduates are going to come out of an accredited program with the same level of surgical experience that a new grad veterinarian would have. So they're going to need mentoring, they're going to need coaching, they're going to need support, but they can also grow into the people that you need them to be in order to support all the cats in the world, Stacy.
Yeah. I mean, I've been around for a while. You were in Massachusetts back in the 80s and then 90s. I started in 1994 in Massachusetts, and I remember several of the private practice veterinarians that we worked with back then when we were only working with private practice veterinarians. Their technicians actually were doing the neuters and doing the non-extraction dentals, and for right or for wrong, but that was happening back in the 90s.
Yeah, and those are unlicensed, unregulated professionals doing things that are outside the Practice Act. The VPA will be doing those things with inside the Practice Act, and so it's actually less liability for you as a veterinarian, to be quite honest.
Right. So it's taking some things that may have been done historically and professionalizing the position and the training, and ensuring that we bring it forward. And I believe there even are some states now where technicians can do cat neuters. And
California is certainly one of them, that I'm aware of.
Yeah. Do you envision, we just touched upon this actually a little bit, but to expand on it, how do you look at that role of the VPA in reducing pet overpopulation?
Yeah, I think, there'll be some studies coming out. One's under review with I forget the exact title of the shelter magazine or journal that it's been submitted to, but the reality is one VPA in conjunction with a shelter of any size can relieve at least one veterinarian of 40% of their responsibilities on a given day. And if you think that gets repurposed to other things that need to be done in the shelter, taking care of sickies and so forth, that it can actually improve quality of care, survivability in shelters, and throughput, which is only going to do more to help pet overpopulation and access to care for underserved communities, for those shelters that have community-facing clinics.
And I also just read an article about how, and this is from the AVMA about how veterinarians who are practice owners are spending 20% of their time on administrative work rather than actually doing what they, clinical work. And in the shelter environment, you'll have a shelter medical director, which ends up sometimes having meetings with boards of directors and looking at HR policies and that kind of thing. So there's a level of sort of bureaucracy too that we all have to be very careful of. But this is another way so that then maybe we can rethink things and ensure that everybody's really focusing their time and effort. If you're developing policies or standard operating procedures, you have the time to be able to do that rather than saying, oh, I'm reacting to this or I'm reacting to that. And so you can be a bit more strategic in your work as the veterinary professional with the support of the VPA with them.
Yes.
Okay. If that makes sense. Does that make sense to you as a practice owner?
Yeah, I think so. I mean, offloading even some of those administrative or strategic things, or the VPA can handle the foster network, whatever it might be, that whole sort of rethinking the paradigm and recognizing that this is a track for veterinary technicians to stay in the profession, to have increased earning power, to also become bigger parts of organizations such as the ones on this call.
So if someone is interested in being a VPA, what are the educational requirements or previous experience that they would need in order for them to become a VPA?
Yeah, so it's similar to what it is on the human side for physician assistant, physician associate, is you need to have a bachelor's degree. The intent for the initial programs is for that bachelor's degree to be in veterinary technology, so that these are actually four-year graduates of veterinary technician schools that have the background and experience. They're not just bachelors of science and animal science, but people that can then move into this master's curriculum, which if you look at the example in the chat from CSU, it's 5 semesters of fairly aggressive academics and a lot of hands-on, including a finishing externship or internship, however you want to phrase it. So these are not going to be rookies. These are not going to be people without experience in the profession. These are not going to be people that are coming out unable to support you in your practice situations. Are they going to need continued mentoring, and are they going to be lifelong learners? Sure, we all are, So I learn something new every day, and I get help on stuff every day. So if we are willing to be in that mindset, these people can be strong assets if you're willing to put in the investment, just like you would with a new grad veterinarian. It'll pay dividends for you.
Have higher education organizations, private, state-funded schools, how has the general response been to this position?
Well, LMU and CSU are on the forefront. There's a number that are kind of hanging on the fence right now, but there's strong interest. There are other deans of other veterinary schools that have been part of the CVPA, and so there's a fairly strong academic interest that these programs, we need sort of something like Colorado's ballot initiative or Florida's legislative processes to give us a little more grounding, I think, to make some of these schools want to take it on. But they're there and they're ready.
You said that the VPA is going to have to carry their own insurance and their own protection. And you've talked a bit about oversight, but let's talk, like, for example, veterinarian from oversight, are they going to have to be in the same room with the VPA, or just within the building, or within the 6 different facilities?
Well, I think that remains to be determined, and it's probably going to be situation specific, but I like the term responsible supervision. So I think, you know, just like any relationship, whether it's a new grad veterinarian that's coming into your practice, you know, there's going to be a certain amount of hand holding and a certain amount of be there with those individuals until you get a comfort level that you know what their skill set is and that they're not going to overstep. Uh, and that would be true of technicians or assistants or associates or anybody. So I think uh, verbiage and practice acts that labels it as responsible supervision, and then I think we as veterinarians know what that is or should know what that is. And again, nobody's going to be required to have VPAs. This is going to be something that will grow and hopefully become advantageous for our profession, just as it has in human medicine.
Mm-hmm. How would this position work in states where the Practice Act does not allow paraprofessionals to have any responsibilities?
Yeah, so this, as we've talked about, is going to require regulatory and legislative change in all states because it's really defining a new profession. It's not a paraprofessional, it's a professional, just like veterinary technicians are professionals. But this is going to be a professional that's going to have the ability to diagnose, treat, do surgery, and once the FDA recognizes, as they did with physician assistants, they'll also have the ability to prescribe. I mean, that's also thrown out there as one of the issues around, well, they can't prescribe. Well, that's because nobody's asked the FDA to create another category. The only category that's been in front of the FDA in that regard has been veterinarians. So all we have to do is ask, and we can get it, as opposed to using it as an example of why it can't be done. Well, it can be done. So,
considering the current state of potential opposition from veterinary associations to the development of the VPA role, you know, from your perspective, do you feel there's enough momentum to move this forward and make it happen?
I don't know if it's going to happen in 3 years or 10 years or 15 years, but I think it's going to happen because I think it needs to happen. And I think, I'll be honest with you, the American Veterinary Medical Association, of which I'm a member and have been for 45 years, in my opinion, is wrong on this issue from a standpoint of their approach is one of fear and one of protectionism instead of one of curiosity and let's see how we can make this work because it's only going to help their membership, in my opinion.
Right. Well, and I honestly, if the model of having the VPA position helps increase access to care, I spent 7 hours watching testimony of the Committee on Health in New York City, and there was 110 different testimonials of various people out there doing rescue, lot for cats, but doing rescue cats and dogs in New York City, and the plight for them to be able to get access to services, affordable services for these animals they're pulling up off the street. I mean, it's tough. And so my desire is to create systems in place so that we can at least have some opportunities here for people in the community to get access to the care that they need for their animals as well as for the community cats that are out there. I don't know how you can explain or, you know, how this position, rather than another person just asked another question again, was, you know, why do we have to have this position versus just elevating the RVT role?
Yeah, so in my opinion, we need all of that. So it's not an either or, it's an and. And, you know, I think veterinary technician specialists are near and dear to me. The first veterinary technician specialist was in emergency and critical care, and I helped to get that going. So I understand the role of technicians in practice, regardless of whether they're specialists or associate graduates or bachelor's graduates. Utilizing them to the max is important, but it's not going to be the whole answer. And there doesn't need to be an either or. I would encourage people to look at this as an and not a threat, but something that can be beneficial as a career track for technicians, as an aid to veterinarians, and as an access to care to the public and all of our stakeholders, whether that's large practice, practice, food safety, take your pick.
I am taking a look at some of the questions that are out in the virtual world too. One question that did come across the wires is, how much of this training would be online versus an in-person?
Yeah, that's another interesting argument. So has anybody been to a veterinary college recently and gone to the classroom when there's a lecture being given? How many of the students are in the room? 15%, 20%. Most of them are waiting for the recording to come out so they can watch it at home. So this argument of distance learning or remote stuff is unfounded because we do live in a hybrid world, and people can learn virtually. Hopefully we're all doing so here at this moment, so that's another fallacious argument in my opinion.
For those of us, that have tuned in today and have been listening to you, and, at the end of this hour or so, if they come out going, yeah, this is great, what is it that folks can do to help facilitate moving this forward?
Yeah, if you're interested, please reach out and connect. We'd welcome you to be part of the Coalition for the Veterinary Professional Associate. We have advocacy as our sort of moniker, and having your involvement with us on a national level or advocating on a state level in the go forward would be greatly appreciated.
Excellent. All right. So I'm going to ask you a question that is in my mind before we even, start. I mean, you've been in the nonprofit space, I believe, when you were with Tufts and back in the day, and then you've also been in the corporate space.
Right.
How does the VPA position impact our costs, our profits? Is this something that's going to generate more profits for veterinarians? And I'm gonna go on the record. I am a part owner of 2 clinics down in the Georgia area, and right now I'll tell you, we're not making a lot of profit. But is this a scenario where it's a way for veterinarians or for corporations to make more money?
Well, I think it has advantages financially for independent practice owners as well as corporate groups. I think whether you are an independent practice owner or an associate or a medical director for a corporation, I think we are in a for-profit world, and so you get paid based on bringing in revenue. So, profit is not a 4-letter word, and the reality is, from a nonprofit standpoint, you'll see this when Dr. Lloyd's economic studies come out, that we looked at 3 different models: the shelter model, the specialty surgeon model, and the general practice. And if you look at revenue for the practice in both of the for-profit situations and throughput or improved outcomes and no cost increases across the board is what the modeling shows for the VPA in all of those scenarios. So, for example, in the small animal surgery model, if a surgeon had a VPA, and these models were developed by discussions with surgeons, these weren't just dreamed up. So we brought a large focus group of surgeons together and asked them, how would you use this person and what would they do for you? The throughput for a small animal surgeon went up by 50%. So they're seeing 150% of what the caseload was. You think they'll make some more money with that? But what also does it do for access to care? So, and it was similar on the small animal general practice side. So again, these are not evil things. These are good things with a lot of wins for everybody. So.
Yeah. I mean, you made a very good point there too, that the challenges, there's certainly very big challenges in urban areas, but there's also big challenges in rural areas. And so much so, the large animal veterinarians are now turning towards doing companion animal surgery because it's just, there's just nothing else available. And so, they're looking at the horses and the cows on Monday and Tuesday, and then they're doing cats and dogs, Wednesday and Thursday.
Yeah, if they're not retiring and going out of business and leaving their county without veterinary services, which is true for about 700 or so counties across the U.S. right now. So again, I think, as you might imagine, I would be an advocate for telemedicine, but if you combine telemedicine with a VPA or two for an equine practitioner, guess how quality of life goes up and access to care goes up for the community they serve, as just an example of what you were illustrating, Stacy. So these are, again, potential solutions. Is it a freestanding solution? No, we need to work on all things as a profession. But we don't need to fear this one. We should embrace this
one. Right, right. I mean, we definitely are at a point. I think it's, it breaks my heart when people say they have to wait 4 to 6 months to get their cat in to get spayed and neutered, even if they can pay $1,200. It's still, those waits are existing, at least up here in New England.
one.
So it's a challenge.
What does that do for pet overpopulation? It just multiplies it,
Right, right. So we would, be able to help. And I mean, and we also want care for we want a feline fixed by 5, right? Our goal is to fix by 5. And so, that's something that we advocate very strongly at the United Spay Alliance. But, you get your kitten at, even 10 weeks. It's like, you're on the wait list for a long period of, or many veterinarians are just not even taking new patients, not even new clients, but new patients adding into the family. So I hear that often also, that and then they're coming to the low cost clinics. They're booking on our mobile spay neuter clinic, the Catmobile in Massachusetts, because we're first come, first serve. We don't do, the resource, checks. So then people who could afford where that opportunity was, they just can't get in, but they can get in on our mobile clinic. So there's just a lot of systems to think about in there, and to think about how we're working. And you talked about throughput a lot and efficiency. And I think that is something that, we all need to think about in our business models, whether nonprofit or for profit, and flexibility too, because a rural area, as you said, you might only have one veterinarian or no veterinarians in a county. You might have them, visiting. You might have someone, a mobile vet coming in, 1 or 2 days a month, and you need to be as volume oriented as you can with that type of a model, for sure.
I agree.
I am just going to scan on the questions. Bree, if there's anything that you're seeing out there in the questions that you want to make sure we pull forward in our conversation. So really nuts and bolts here. We still have confusion on what's the difference between a VPA and a veterinarian.
Well, it's a 2-year degree. It's not as comprehensive as what we have in the 4-year curriculum for veterinarians, but it is robust, and it is not light, and it will be accredited, and it will be licensed, and it will be regulated. So again, I think look at the PA world and how it functions in a practice with physicians, and so that's the model. So for example, in an ER clinic, maybe the VPA is handling the urgent care, the street cases, while the veterinarian, the criticalist, is in the back dealing with the sickies. So how often are people being pulled from oversight of severe cases to see the vomiting dog or the itchy dog or whatever? So those are some examples of where responsible supervision, diagnosis, and treatment can be handled by somebody that's on a PA level, which is what this is. It doesn't have to be the criticalist seeing the case.
So can I ask you to get even more specific? So neutering a cat would be with the VPA. Yes?
Right. Yes.
And a vet, same. And then spaying a cat, both?
Both.
Okay. Neutering a dog?
Both.
Both? Spaying a dog?
Both.
Both. Dentals, low-grade dental, both all the way through to full mouth extraction?
I think so. Again, if you look at the CSU curriculum for the VPA, they're actually going to have 3 times the amount of hands-on dentistry that the veterinary graduates currently get at CSU. So does somebody come out as an accomplished dentist from veterinary school? No. Are they going to need mentoring and support? Yes. But can they get there? And is this something that has to be veterinarian only? If you believe that, then you're welcome to that belief. But in my opinion, it's something that we can leverage and share and increase livelihood, increase longevity in the profession, increase well-being, increase profitability, increase access to care. Take your pick of the column you want to pick here, but it's all good. It's not bad. It's good.
And then, so specialty surgeries like leg amputations, tail amputations, blockages, any of those specialty things?
No, I don't believe so. Again, could it come to that down the road, perhaps? Again, it's responsible supervision. So if a veterinarian has a comfort with their VPA that they're able to do a splenectomy with them in the building to back them up if need be, I don't think we want to do what we've done to many technician legislative initiatives, which is create a task list that's limiting. Let's be thoughtful, and that's where the word responsible supervision comes in, instead of, well, you can only do this, but you can't do that. Well, what if you're in rural practice, and what if you're in shelter medicine and the hit by car comes in that needs its leg amputated, and your veterinarian is busy with another thing? I mean, who knows what the scenarios might be? But let's do it right. Let's be thoughtful, but let's not be knee-jerk.
So I'm going to ask, so if you're saying that the technicians have limitations placed on them, then this VPA position would have a little bit more latitude. Is there a desire to try and have like this responsible language with the technicians also?
If I were to legislate in all 50 states, I would say yes. And if people want to advocate in their own states for stuff like that, whether you have technician licensing now or don't be overly prescriptive. Be thoughtful. Again, we're elevating technicians. We're considering them our professional colleagues. Well, then treat them that way.
Right.
Regulatory-wise.
And you told me an astonishing figure. What was the number of states that just don't even recognize licensed technicians?
Well, it's becoming less, but it's somewhere. It was around 10. It may be about 8 right now that don't recognize better. You can be an off the street trained technician and not have gone to school. Florida would be an example, although that's being worked on. Colorado was sort of until this last year, so it's interesting. I mean, we've had as a profession decades to fix that, and now all of a sudden it's used as an argument for progressing on other fronts, so let's do it all. Let's get it done.
I know you're going to say this is an and, not an either or, but do you foresee this position? I'm assuming the cost of the education will be less than getting your veterinary degree, And we all know that veterinarians, have the highest amount of debt, blah, 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 when they come out of school. So do you think that this may direct more potential veterinarians to become a VPA?
Well, I think it's another career option. That's a good point that you raised, Stacy. So last year there were 12,500 applicants to veterinary school in the United States for about 3,800 positions. And we all know people that have tried multiple times to get into vet school but haven't been able to, but could be just as qualified as the next person. I mean, the person that ended up being valedictorian in my class was off the alternate list, when I went to vet school. So I think there's opportunity there for that cadre to have a professional pursuit in our profession. The cost of the education, I think the master's program at CSU is pegged for in-state people at around 50 grand, 45 or 50 grand. So affordable. Thankfully enough, in the last few years with salary increases for veterinarians, that student debt to income ratios come down from up around 3 to 1.5 to 1. So it's more livable, and every veterinary graduate going forward hopefully will be able to retire that debt before they retire. But is it still an issue that needs to be looked at? Certainly, but it will be an economical option, I think, for people that don't get into vet school and for technicians that want to go to the next level. And the salaries that I mentioned for those models that will be published soon, the salary for a VPA in those models was $100,000 a year. Not insignificant.
Mm-hmm. Is there going to be a limit on the number of VPAs that a veterinarian can supervise?
Yeah, I think that remains to be looked at, but it's, I think it's a reasonable number, 1 to 3, somewhere in that ballpark has been what has been discussed. Some of it may practice situations and so forth.
Right. And then also, I'll just go back on the debt conversation there too. If you work for a nonprofit for X amount of years in some states, you can have some of your debt forgiven also, I believe. So it's another thing to think about.
Yeah, I think, that needs to be a more robust program for veterinary graduates, and it certainly could be an option for these VPAs as well to have that in-service and debt forgiveness. That would have to be another piece of legislation. So that's yet to come, but yeah, sure, why not?
I mean, a hands-on training, is so critically important. And I've had free spay and neuter clinics for feral cats in Massachusetts since 2000 on a monthly basis. And, we've had a lot of young graduates utilize those Sunday clinics with the experience of the other lead veterinarians. We have 6 or 7 veterinarians there on a Sunday, and they come and they learn, and they're just like sponges, because when you first start out in practice, you're not going to be doing a lot of active surgery right away, but they want to learn. And so that they use these clinics as a way of, and then those that have maybe been away from surgery for a while, they come back to kind of refresh and all that type of stuff. And so, the more we can have folks critically involved in the community and looking at the new tips and tricks and tactics and all that stuff, I just think that that's absolutely really awesome.
Yeah, I think we need to find ways to come together. We're a small profession. We're a needed profession. We're a valued profession, and we shouldn't be fighting each other. We should be working together to find the solutions that are going to help our own well-being as well as the well-being of the constituents that we serve.
All right, so I'm gonna have a sort of philosophical conversation here about sort of, veterinary medicine has been evolving and changing, with so much of the purchases of the private individual practices getting purchased by corporate. Tell me if I'm wrong, Bert, you're more in this than I am, but my understanding is now corporates are less interested in the single owner practice, they like more of the bigger ones that might be of more interest, which is actually harder than for those vets that are maybe trying to retire and to get a, like, you know, the new replacing the country doctor is a great challenge, and the corporate world may or may not be necessarily, you know, as interested in that. And so, you know, but would you say that like the corporations are supportive of this VPA model, or are they still undecided?
I think they're mixed. You know, I would say that the leadership that I've talked to is, you know, that all of these same issues that we've discussed here for the last several minutes have come up on all levels. So I think I would just invite everybody to take a, you know, an educated, intellectual curiosity look at the roles, and it may not be for everybody. It might not be for your independent practice, or it might not be for your corporation, but it does that mean that you should stifle it for everybody? You know, um, so I would encourage people to just approach it with an open mind, and look at what it could be instead of a fear-based, what it's going to do to me mentality, because it's got some significant upside for everybody.
Yeah, I'm actually just reading a note here, and it's like now thinking, whoa, it's true for me too. So in Maine, nurse practitioners can open their own practices, and here in Vermont, I have a nurse practitioner right around the road where I used to have to go to a doctor over an hour's drive, and she had a 3+ year waiting list. So I was actually without a doctor for 3 years until I got into her practice. But then this nurse practitioner opened up right down the street. Do you envision it getting to that point where a VPA could potentially sort of have their own practice, maybe in, you know, designated rural areas?
I think that's something for discussion. I think, you know, it's like anything else. Let's start small and start with some level of comfort and control. And I think that's what is being proposed currently for the VPA role in veterinary medicine. Again, PAs and nurse practitioners have been around for decades on the human medicine side, and is there an expected evolution as you just described? I think so, Stacy, but I don't think that's an out of the gate approach that I would recommend in any way, you know.
All right, I'm just scanning a few questions. We are almost at the end here. I do appreciate folks with your questions and your comments. And I hope you have felt that today's conversation has been beneficial. Do you get any sense on you said, you know, it could be 3 years, it could be 5 years, it could be 10 years. You have absolutely no sense on the timeline on how this would move?
Well, I think we'll know more on November 5th, which is when the ballot initiative in Colorado, the decision will be made on whether that becomes part of the structure of veterinary medicine in the state of Colorado, and then CSU's program will initiate. So I think if that fails, then Florida has a legislative session next year, which might bring it back to life. Florida has an interesting legislative session. They have like a 2-month window, so it's not uncommon for bills to take 2 years to get through the legislative process in Florida, just because you can't get it through both House and Senate in the same session. And just for anybody that wants to know, the VPA legislation passed the Florida House 116 to nothing last year, as an example of maybe where the general public and legislators are going, well, we have this on, I go see a PA, why wouldn't my pet be able to see a PA if it was in a structured fashion? So I think, again, organized veterinary medicine might actually be behind the times here in its current approach, and I would encourage people to rethink what their viewpoints might be based on our discussion here today.
And I'm just catching, you know, we've got like lots of, you know, comments out here. I mean, I think we do need to acknowledge, you know, we do have a vet shortage out there. There are so many open positions and that are not getting filled. There are businesses going under because of that. There are quite a few. We had about 50% of the nonprofit clinics went out of business, and due to financial as well as staffing shortages. And I don't want to just say it's just the vet shortage. We've got technician shortages. I mean, it's a team effort in order to make a practice work. We have a lot of gaps out there. We have a lot of things, and folks are saying, we don't see how the finances work here. We don't see how you can lower cost, increase access to care. You can increase the number of appointments you're able to serve. As you said, 150% increase in appointments. And so, I think folks are thinking out there, okay, so then that's, you've got, let's just say 10 spays at $1,200. Okay, we're gonna make it 15 spays at $1,200. So there's more money there, but that's, at the end of the day, it's not necessarily about the money, it's about the volume of what we're able to treat, because we have animals on the streets right now that we're not able to treat. And I'm respectful of everybody's opinion. Everybody can have their own opinion out there. But I do, though, want people to understand the stress that the small rescues out there and families are feeling in terms of being able to get care for their pets and the animals that are out there. And we've got to think about models that are scalable. And, if this can increase the number of appointments served within a clinic, that's going to benefit the community. And please tell me if I'm wrong, Dr. Mert, but that's my soapbox.
Yeah, and I think, just like veterinarians are motivated by different pursuits, so will these professionals be motivated by different pursuits. And so they will gravitate towards high volume, low cost clinics. They will get engaged in community service pursuits that will help with access to care, not $1,200 spays, but in the supporting the rescue groups and population control in every community. I'm convinced of that.
Excellent. Well, we are at 2:57. This session is being recorded, folks. So I just want to let you know the recording will be out there and shared. Please take a minute to download those handouts. Bob, any further comments that you wanted to share with the group while we close out?
No, I just appreciate the opportunity to address the issue with you here, Stacy. Thanks for the opportunity. And again, I'm happy to engage with anybody individually or collectively after this session if they want to continue the conversation. I'm easy to reach. So.
Excellent. All right. Well, I want to thank you all for attending. I would thank you, Mert, again for being here today. Folks, if you're interested in checking out more, we're actually going to have another webinar in January, I think. And we also have the United Spay Alliance Conference, which is just coming up. Bree, I don't know if you want to just share a little bit. Bree, who's our administrative director, if you want to just come on the, just share with us what's coming up at United Spay Alliance's conference in a couple of weeks.
Yeah, I dropped some links in the chat for everyone. So if you want to take a peek, and I think that's also in your handouts, and then there's a quick link to just our Drive document. But we have a pretty exciting schedule. And part of how this webinar came together actually is we reached out to Dr. Mert for our conference, and there's a lot going on in October for folks, but we're able to make today work, and so we're very grateful that he could work us in. But we have a lot of content for folks on how can we increase access to affordable spay neuter. I mean, that's really at the heart of everything, is we want more spay and neuter available. And so whether there's a session on, the more private practice model, there's a MASH clinic session. I think there's just increasing efficiency in your teams and your processes overall. And of course, we're going to talk about some of the things that we're doing here at United Spay Alliance to help out in, that area as well. So lots of really great content and lots of people who are doing some cool things. And so we're hoping that it's going to be a very informative weekend, very inspiring and empowering weekend for everyone. But yeah, so links in the chat. We hope everyone will consider registering. Scholarships are available thanks to Jody Bernard Foundation and Feline Fix by 5, we have scholarship opportunities for folks because we want absolutely anyone to attend who would like to come and learn with us. So looking forward to it.
All right, everybody, have a great day. Take care.
Thanks, everybody. Bye-bye.